Hi, I'm Dr. Vinatha. I'm a senior consultant in Cloudnine Hospital, Hitech City branch in Hyderabad. Prolapse doesn't always mean it is only the womb that is dropping down. That certainly is one part of various problems that we see with prolapse. So what all can come down? Uterus or the womb can come down. That is called uterovaginal prolapse. When that is coming down, the weight of the uterus also drags the bladder down. When that happens, we call it as cystocele. Cysto means it's like cyst-like thing, that is bladder is like a fluid-filled structure. So we call it as cystocele is when bladder comes down. What is rectocele is rectum, that is the motion passage. When it comes along the back of the uterus, then we call it as rectocele. And sometimes the bowel that is higher up can also come down. We name it as entrocoele. And where the tube where you pass urine, it is not the bladder, but the tube where you pass urine, it is called urethra. When that also comes down, we call it urethrocele. These are the names of various types of prolapse. What if uterus is removed for some reason or the other? Then the top of the vagina can also come down. In that case, we name it as vault prolapse. Vault is the top of the vagina that is stitched at the time of uterus removal. So that can also drop down when there is no support. So these are various types of prolapse. Now let us look into stages of prolapse. There were various trying grades and stages that were come long way over the years to try and differentiate between various degrees or stages of prolapse, so we can tighten our treatment and explain our women that what stage the prolapse is and how are we going to do the management of that particular prolapse. So the recent and the most accurate means that we follow is a POP-Q system. That is a pelvic organ prolapse. It's a very quantification test, very specific. It is not varied. So when we have to compare different doctors examining different women or the same women examined by different doctors, we can quantify it very accurately when we follow this staging system. Usually staging is such that when uterus drops down, but we cannot see outside, then we call it as stage 1. When thump is felt at the entrance of the vagina, but not completely outside, we call it as stage 2. When some lump is coming down the vagina and you can see and feel between your legs, then it is stage 3. And when the total length of the uterus is outside, drops down, we call it as stage 4. So this is a rough staging calculation that we use. But POP-Q is a very specific quantitative system that we practice. Most of the urogynecologists will practice this system. That's a method of documentation before and after we can compare.